I'm the livestock extension agent for the Sunflower District. So that's Cheyenne, Sherman, and Wallace counties. Tonight, we are really excited to have Dr. AJ Tarpoff with us. Tonight, he'll be talking about managing disease around calving. So we've had Dr. Tarpoff in the Northwest region before. His talks are always well received. He likes to give you information from the producer's perspective. That way you can actually use that information that you want and that you need. So a little bit about his background. Dr. Tarpoff earned his bachelor's, his DVM, and his master's from K-State. After earning his DVM, he went on to accept an associate feedlot veterinarian position at Alberta Beef Health Solutions in Canada. His focus in practice was herd-based cattle production medicine, research field trials, disease surveillance and mitigation, among other things. In 2016, he returned to K-State to fill the role of beef extension veterinarian, where his duties include extension work, research, and teaching. So again, he's a wealth of knowledge when he comes to the Northwest corner here. His talks are well received, so take advantage of him giving us his time tonight. Ask him a bunch of questions, and hopefully with this small group, we can have some discussion at the end. So I will open the floor up after his presentation for questions, so you can just ask your questions aloud. Otherwise, you can put them in the chat box or send them to me privately through the chat box. So we're happy to have you. Dr. Tarpoff, the floor is all yours.
Well, sounds great. So thank you very much, Heather. And it's always a pleasure to visit with producers. I was in visit with a group in Northwest Kansas or Northeast Kansas yesterday. So now we're visiting with Northwest and really kind of all over the state. So yes, if you have questions as we go along, by all means, just either shout those out or type them in the box. We can address those as we go. But this is meant as some reminders and some tips and tidbits as we're going into the season and dealing with pretty situational issues, okay, due to time of year, due to weather, due to conditions, due to pregnancy losses, potential like that. So anyway, we'll kind of jump into this. When I discuss any type of disease, I do have to point out that disease always happens for a reason, right? We have immune function that defends our animals against different types of pathogens, but the pathogen load and that threat to that animal is typically always in the environment. Okay, so we always have that potential risk of having some of this disease interaction. Okay, if our immune function is high enough, we do have a balance. It balances itself out where we don't necessarily see disease. And it's a good idea to review things that help the immune system, help our animals, and then things obviously that hurt. And I think the things that hurt, we understand very well, but really, management and things that we can do to impact the immune system really comes down to back to the basics. Okay, our basic husbandry practices that we do day in and day out make the biggest differential of the health and well-being of our animals every single day. Okay, so never forget that. It's the everyday husbandry practices, the grunt work, so to speak, are the most important factors for our animals. Quality nutrition. Dr. Blasio was on this discussion last Thursday, discussing a little bit about nutrition. Okay, nutrition is king, especially this time of year with balancing the needs of these animals, whether they're growing, whether they're gestating, whether they're lactating, or whether they just hit the ground running. Nutrition is absolutely key. Environment. We can't control the environment. We can't control the weather, but we can modify the environment to make sure that the impacts of some of the situations like the weather that we're receiving right now may not impact our animals quite as hard. Here I am a veterinarian. I do have to talk about vaccines a little bit, but I do have it further down on the list. Vaccination programs are a critical piece of our animal health protocol for herd management. But again, it's only just a piece. Good vaccination protocols can always be overcome, by threats, okay, by threats in the environment if we don't manage things appropriately. And I do like to point out that maturity is also really critical. Okay, it takes 2 years for a bovine, a cow, to actually develop and have a full developed immune system. Okay, so our baby calves, we'll talk about their immune system, but even some of our younger heifers, they're still developing their immune function. They're not fully developed yet. So those are all good things to keep in mind. And then things that hurt the immune system, it's everything that we know inherently. Okay, stress. I just couple everything into stress. Right now, we're dealing with the stress of weather. We're dealing with the stress of calving, the stressors of nutrition on what we have available to be able to feed them. There's a lot of different types of stress that are interacting with our animals right now. So this is what we want. If we vaccinate or if we use animal health products, we're trying to increase that barrier of protection from the disease challenge and help booster our immune function against particular pathogens, again, that can cause particular diseases. Okay, so that's all basics. That's just good things to keep in the back of our mind as we discuss tonight. So tonight I'm going to talk a little bit about protecting the calf. Ultimately, that's kind of what the goal is tonight, is protecting the calf, both just prior to calving and also after the calf has hit the ground for the first couple months of life, and throw out a few tips and tidbits as we go along. So gestation is pregnancy. So and that's kind of where we'll begin. And I think this is a great opportunity to bring up abortion. Okay, pregnancy losses. They do occur for a number of different reasons. Okay, and it's a good thing to point out that not all of them are infectious. Okay, not all of the causes of abortion are caused by a particular pathogen. Okay, we could have things like nitrate levels, nutrition levels. We can have weather storms that cause such an undue stress to the animals that they themselves actually terminate that pregnancy. And it's not alone with just spring calving herds here in the middle of the winter. We see the same things even with heat stress, that we can have pregnancy termination for some of the fall calvers. So there's numerous causes. And here on our infectious side, this is an ongoing list. We know that there are multiple pathogens that can actually cause abortion and early pregnancy loss. Some of them we can control. Some of them, unfortunately, are sporadic and they just happen. Okay, so I'm going to kind of focus on what those look like, what we manage, what we deal with, and just so we have a better understanding on when we're having some of these issues, what they might look like, when we should interfere, when we contact our veterinarian. Okay, I think some of the common ones we should begin with, just to have a basic understanding, are some of our viruses, our bacteria, and then also our protozoals. Okay. I think our most important viral issues with pregnancy really are IBR and BVD. Okay, infectious bovine rhinotracheitis and bovine viral diarrhea virus. They're almost in every single vaccine that we administer to cows. These are critical pathogens that we try to get some protection against. And I'll talk a little bit about what those look like or what they do within our herds, but they can be pretty devastating. Bacterial. This late in the season, if you're getting ready to start calving, there are some areas that we can run into some issues with leptospirosis. Lepto can cause issues in numerous species, but in particular with cattle, we can run into some gestational issues, and we can have some pregnancy loss. And then we have a kind of a nasty protozoal called Neospora that flares its head a little bit, and I'll talk a little bit more about that on where we've seen it more recently, and it really just begs to differ. We have more questions than answers when it comes to Neospora. It's actually a protozoal parasite that's naturally carried by coyotes. Coyotes, dogs, it's passed in their feces, and cattle just happen to come about it, and it can cause some issues in them. And I bring those up because our Kansas State Diagnostic Lab here at K-State, through the veterinary diagnostic lab through the veterinary school, they do compose all of the submissions that come into the diagnostic lab. Abortion workups through the diagnostic lab are often very challenging. Either the tissues that are submitted have already, it's called autolysis, they've already started to rot, or not quite the proper tissues were actually submitted, or not enough of them. So unfortunately, it's not always 100% whenever we send in samples to the diagnostic lab. They do the best they can with what they receive. But if you do send in samples, which we'll talk about that here in a little bit, it is critical to take that seriously and kind of when to pull the trigger to send samples in and sending as much as you can. What was interesting in 2019 when they compiled all the information from abortion workups that they did, early pregnancy losses, we ran into a couple of different things that wasn't necessarily expected and from years past. The first was about 30% of the submissions actually had Neospora, that parasite, that protozoa. What was interesting about those cases is while it looks like a large number, like a major cause of abortion, when they looked at those tissues under the slides, it's called histology, when they looked at them under the microscope, there was very little changes. So it causes some skepticism whether those were actual causes or those were just incidental findings. So basically, it's not a cause and effect always when we see Neospora, because cattle can carry that particular protozoa for their entire life. So I like to point that out. So if you do get some of those results back, if you send some tissues in, have that conversation with your veterinarian and make sure that you do have a full understanding of what that really means versus if it's truly the cause. Okay, BVD and IBR, BVD kind of followed next. What was interesting is usually IBR, the virus IBR, is one of our key causes of late-term abortions. For whatever reason, in 2019, it drastically decreased. They don't fully understand, and we don't fully understand why we had a decrease in submissions that came in that actually had IBR, but that was fairly abnormal for our year-end and year-out results that come in. Obviously, we have nutritional causes, nitrate issues, nutritional, protein, and energy issues, some bacterial, but some fungal as well. But far and wide, usually we're dealing with some of our usually our viral issues that are kind of coming through a herd. So I think that's the next step is all of these things are here. They're in Kansas. They're in particular herds. They circulate at different periods of time. What do they look like? Okay, and I like to point out just kind of the basics of what some of these situations might look like, just so you're aware that if anything remotely similar of this is happening, to really contact your veterinarian as soon as possible for a workup. So BVD, the virus, BVD virus, BVD does a number of different things to gestation and pregnancy in cattle. Everything from abortion storms, where we have multiple animals all terminate their pregnancy, to individuals. We can see birth defects. We can see stillborns. We can see all of these different things with BVD. Not only late term, but midterm. It can really cause some devastating effects. And why we worry so much about BVD is due to the creation of what we refer to as persistently infected cattle. This is what we ear notch for and send into the lab for PI tests on calves. So we're trying to, those animals will actually be born with the virus and shed it their whole life. That's what we try to prevent. That's kind of the nidus of infection. The next is IBR. Okay, so late term abortions. Okay, so we're talking third trimester. If you're getting ready to calve now, this is where we can see some of these issues. It can happen with individuals. It can happen throughout a group. And more often that we have some type of addition or we have some type of exposure of our herds, either through fence line contact or recent additions, like buying some heifers, buying some other cattle, bringing another animal close by that could be circulating that virus, that we had some type of introduction of that virus into the group. And that's where we'll see some of our IBR issues. Vibrio, we do vaccinate regularly for Vibrio, but that's for early pregnancy issues. But lepto, we can see some abortions with lepto. We can see some mastitis, some kidney infections, some kind of random things that we can see. But all of these have the potential that cause some of those pregnancy losses. Regardless of what the pathogen is, the control, the basic control, it does remain the same. Okay, some of our basic techniques that we'll use, our herd health management plan, biosecurity. Biosecurity is key. whether it's abortion losses, whether it's different types of disease risks. It's all about prevention of introduction of that disease. Okay, so first and foremost, if you bring in new animals, especially in and around calving, please segregate those animals for 30 to 45 days from the rest of our herd. They can still be circulating even low amounts of virus. They can be shedding different things in their feces. They will clear those out. A lot of times it's subclinical. They don't show disease. Okay, but one basic thing that we can do is segregate new additions to our herd for at least a month prior to introduction. Okay, especially around calving, and that includes graft cattle. Okay, if you have a cow that lost a calf, not due to her fault. If we had a frozen calf that unfortunately died, getting a graft calf and put it on that cow, if that's what if that's what you choose to do to keep that cow in the herd, please segregate that cow and calf. Okay, oftentimes those calves can still be replicating, and they can still be shedding virus from wherever they came from. Just because it's a different amount of pathogen than what's in your home herd. Okay, so these graft calves can be a severe nidus of infection to the rest of our animals, especially during calving season. So I understand the practice, and absolutely, I fully understand that. But if you're going to do that, make sure that we try to segregate those calves for a period of time before they run with the rest of our cows. Disease testing. Okay, there's some things that we can disease test for. Really, what I want to focus on with disease testing is if you're having issues, if you're having abortions, everybody asks, Doc, when do I call? When do I make the decision to send in samples? And my honest answer is it depends a little bit for everybody. But my rule of thumb is if I have had 2 or 3 in a short period of time, I'm sending samples. I'm concerned about what could be coming. If it's one oddball that occurs, there's a lot of other reasons why that could instead of an infectious cause. But if we start having a group, if we start having multiples in a short period of time, that's where my caution, my concern starts to really rise. That's where I would be contacting your local vet to try to get the proper tissue submitted to the diagnostic lab, and they can help you with that. If we are going to be submitting tissues, some of the most important tissues that we can get to help with the diagnosis of what's going on with those abortions and those animals is number one, the fetus. Okay, the fetus in its entirety. If we can gather that, that's one piece. If we have multiple abortions, the more fetuses that we can actually gather to send in the lab, the better. On top of that, if we could also gather some of the placenta itself that actually surrounds the calf during gestation, many times that placenta will house whatever type of pathogen is causing the issue. Okay, it may not be transmitted directly to the fetus, but it will be in the placenta. And submitting the placenta as well will greatly increase the odds of us actually finding some type of diagnosis. Okay, so again, those are some things to keep in mind. But if we start seeing a cluster, if we have more than 2, we should really consider contacting your local vet to send some of those samples in. Okay, so vaccination strategy. I do mention vaccination strategy, and this is something that we all set up, but I do like to give some general basis for some things that we can use. For things like Vibrio, we're a little bit late to the ball game. Okay, these are things that we vaccinate for pre-breeding, and most of these products we will end up administering pre-breeding that we do in the spring. So this is something to consider before breeding season this year. If you don't routinely do pre-breeding vaccines, these things can be these can be administered roughly a month before breeding. Okay, so we have the calves on the ground; they're still lactating, everything is going well, and it's kind of that pre-work just before going to grass is where we can really implement some of these strategies. At preg check, obviously some operations, some producers and veterinarians recommend giving a lepto booster potentially at that period of time. If you're going to be preg checking late, just to know, pregnant or not, we can also utilize some scour prevention vaccines where we can booster the immune system of the cow so she can naturally transmit some of the protective antibodies to that newborn calf. Okay, and that's where 3 to 6 weeks, that's what's on the label. Everybody asks, is it even worth it if we give it at preg check, if we preg check a little bit earlier than that, if it's a little bit outside that 6-week window? They will still have circulating antibody that's enough to concentrate into the colostrum. Would it be quite as effective as if you gave it right within that period? No, not necessarily, but we still see some response and some concentration of those particular antibodies into that colostrum, and obviously that's what we're trying to do to transfer that to that newborn calf. Okay. So that's abortions. Okay. And I want to keep that kind of quick and sweet and kind of to the point on that. But just keep in mind, if you have a cluster, if we're seeing some of those issues that, that are happening late, if we're having, very premature calves that are coming out, they don't have hair, the hooves aren't quite developed. Those things, those would be considered early term. They could be, pregnancy losses. Okay, so those are things that we would be looking for, that we would try to investigate on. When you do submit anything, when you have the conversation with your vet, gathering as many of those fetuses that have been lost. If we can send in multiple, and if we compare those with placenta, we can really get some of the best results out of those animals. Just forewarning, for further diagnostics, your veterinarian may want to take blood samples from the cow, from the dam herself. Sometimes she might be circulating something that we won't find in those fetal tissues, but we can find in the cow itself. Okay, so that may be something that they'll ask for as well. Again, just a good brief overview. We have viruses, we have bacteria, we have protozoa that can all cause it. They're all here. We routinely see those, but occasionally we can see some of these flare up as some of these abortion issues. And those are the steps that we go to help kind of track down what it could be and make management changes after we found what it is. So let's talk a little bit later. We get full term. We have a pregnant animal that goes full term, 285 days, and we get a live calf on the ground. And unfortunately, we're dealing a little bit more today with the picture on the right with the little calfsicle. We've got cold temperatures, extremely bitter cold temperatures. We're calving. We've got a lot at play going on right now. So I think first and foremost, trying to get this calf off to a good start is absolutely critical early in life. Not only for the survival within the first few days, to get the energy and nutrients into this newborn calf, but also to provide the protective immune system of this calf for the next couple months of its life. That is the first mother's milk, the colostrum. Calves are born with a fully functional immune system, but it's never been challenged before. That means they are naive to everything in the environment. Okay, it takes time to build immune function. It takes 2 years to build that. Thankfully, as mom's birthday present to the calf, she will give that calf a functional immune system through colostrum. Okay, and it is critically important that they get as much as that colostrum to be able to get the antibody to absorb through the gut wall to act as their functional immune system for the first couple months. The colostrum is packed full of antibodies. It's got white blood cells that combat pathogens directly, but it's full of fat, vitamins, everything they need, even on cold days, to really get up and going. Everybody asks, okay, well, all right, well, how much colostrum do they need? Okay, and the rule of thumb, everybody says 10% of body weight. Okay, realistically, it's a gallon. Okay, they need a gallon of good colostrum from their dam, their mother, to get off to a good start in life. Okay, so that's a good volume to shoot for. Absorption time. Okay, we do have a ticking clock when it comes to colostrum absorption. I'm sure many of you have heard 24 hours. You have 24 hours to get colostrum into a calf. Technically, yes, that's when the gut closure happens. So when calves are born, the gut is not actually sealed. Okay, it's actually porous. It has these small openings. The reason it's like that the gut wall inside the intestinal tract isn't closed, is these big cells, the antibodies, they're big proteins. So they cannot just get absorbed through the gut wall. They can only get absorbed if that gut lining isn't quite sealed yet. And that's what happens early in life. Within the first 24 hours, we still have a porous gut wall. These antibodies are able to absorb through that gut wall and get into the bloodstream where they have to be active. Okay, so we do have a time frame that we're dealing with. Realistically, within the first 2 to 4 hours of life is critical if we can get colostrum into them within that period of time. We do start seeing closure after that period. Okay, within the first few hours, that's where we start having gut closure. By about 9 hours of life, they've only been on the ground for 9 hours, we have 50% closure. Okay, while we still have some porous openings up to 24 hours or thereabouts, by 9 hours, we've already lost 50% of our effectiveness to be able to absorb those antibodies into the bloodstream. Okay, so that's why timing is critical. The other thing to consider is a colostrum does not absorb very well in very cold calves. That's the other issue that we're dealing with, especially within the past week and this upcoming week with these extreme cold temperatures, dealing with hypothermic calves, which we'll talk about here in a couple minutes. When we have cold calves, they don't absorb colostrum quite as well. Okay, so that's another concern that we have to keep in mind. So what are the risks? What if they don't get colostrum? It's pretty substantial. Okay, they're 6.5 times more likely to get sick as a neonate within the first month or so of life, usually with calf scours. We'll talk about calf scours. They're 3.5 times more likely to get sick pre-weaning, usually with respiratory disease, and they're 5 times more likely to die. Okay, that's how critical it is to get colostrum into these calves. If a situation occurs that you have to separate calf from mom, okay, the calf wasn't the cow wasn't, or the heifer wasn't lactating like she should, threw the calf into a snowbank, we had to gather that calf up and go warm it back up. Now we have to supplement that colostrum. Okay, if you're looking for a kind of our go-to, our traditional go-to is if we don't have fresh that we've fresh or frozen that we've collected on farm, we'll traditionally go to a commercial product. They come in pre-packaged powder packages that you can buy just about anywhere. I do want to warn you that there are replacers and supplements that are available on the market. Okay, supplements are for situations that calves have already nursed. Okay, they've already consumed colostrum. We are just concerned about the quality of that colostrum. This is a product that we would use if you're worried about a cow with some bad teats, not sure about the volume that's coming out, or young heifers that may not have the volume that you would like to see. This is where we would situations where we would use some of the supplement products. But if we are going to be replacing the colostrum, that is the only colostrum that calf is going to consume within that first 6 hours of life, we really need to lean towards replacer products. And yes, they are about double the price of what our supplements are. They're specially formulated. We try to find replacer products that are at least 100 IgG. Okay, 100 or over IgG. That's called a immunoglobulin. That's the level of antibody. Okay, and that's the level of antibodies that we will have in these replacer products will typically be over 100 IgG, and that's really what we want to try to target and try to find. So obviously we'll either be giving that by nursing, giving them through a bottle or through an esophageal tube feeder. If given the opportunity, I really try to have calves nurse from a bottle rather than give an esophageal feeder. Okay, when they nurse from the bottle, they actually bypass their rumen and go straight into the abomasum when it gets absorbed. And it's a part of the suckling activity. It's called an esophageal groove. It's a kind of a fold that happens inside the stomach. It's an amazing mechanism. So when given the opportunity, I try to take the extra time to allow those calves to suckle if they will suckle from a bottle rather than just tubing them and getting it done quickly. So Heather, I saw you pull your mute off. Was there a question?
Yes, so a question did come to me privately, and this person asked, can I give that gallon of colostrum in one feeding? You had mentioned that 1 gallon of colostrum is a general rule of thumb, and I'm going to add a secondary question to that, just out of my curiosity. Is that going to change versus tubing versus having that calf eat from a bottle?
Okay, so yeah, so overall volume within early in life, within the first several hours, yes, we target 1 gallon. But I will be the first to admit that the stomach of the calf, a newborn calf, will not fit a gallon. Okay, and if you force a gallon into that stomach, it can actually rupture and tear. That's something I've actually seen and I've witnessed and I've diagnosed on necropsy. So no, we generally split that 1 gallon volume, especially if we have to administer it. We split that into 2 feedings, and we can split those feedings by 30 minutes or 30 minutes or an hour, where we can split those into 2 feedings within the first several hours of life, that we can still get the same volume in. So no, regardless whether they suckle or we tube, we're still after that same general volume. Okay, so if we have to mix up a replacer bag, that one replacer bag is generally one volume time. We may have to split that still into 2 feedings. Okay, so whether that's through a nipple or whether that's through an esophageal feeder, it would be the same volume, the same amount. Okay, just knowing that if they have the ability to suckle on their own, it will be absorbed a little bit better. Okay, just because sometimes it goes into the rumen, and that's not where we have the best absorption for the milk early in life. Does that help answer those?
I think so, and I
Sounds
haven't
like it.
heard anything else in chat, so I think I would consider it answered.
Good. Okay. Now, one thing I want to point out and warn, we talked about biosecurity and making sure that we don't introduce disease. Unfortunately, if we get fresher frozen colostrum, that's why I have a dairy colostrum with question marks. If there's a dairy nearby, they got piles of colostrum. Unfortunately, we try not to use fresher frozen colostrum from another cattle operation. Unfortunately, we can introduce diseases that take a long time to deal with and a long time to show up. Things like Johne's disease, where they have chronic diarrhea when they're older cows. Things like bovine leukemia virus that causes leukosis, that issues much later in life. Unfortunately, we can introduce diseases like that from something as simple as colostrum from another operation. So we generally try not to use those if we have that given opportunity. And I understand, I mean, if that's the last ditch scenario, believe me, I understand we still need to get something into that calf. But just realize that would be much further on the list if we had the opportunity to give something else. So again, colostrum, about a gallon, split into a couple feedings within the first 2 to 4 hours of life. If they're cold, they don't absorb it quite as well, so we do the best that we can. So other things, how do we affect this immune transfer? What are some things that impact quality of colostrum, how well that calf is able to absorb it? What about the volume? Are there some things that we can do to the cow? I talked about scour vaccines and things that can be transmitted to the calf through vaccinating the cow, but there's also a number of other things that impact colostral quality. Okay, age is a big one. Our middle-aged cows generally produce the best colostrum. Okay, our young heifers are still developing their own immune system. They will not produce the quality or quantity as our middle-aged and our good, happy, healthy cows. Okay, that have been here for a while and under our management. The other thing to consider that really probably one of the biggest impacts of colostrum quality, other than age, is body condition score. Okay, how much fat cover do our cows have going into calving? Okay, there's been some work done, and I'll show you a slide next, that if they are a little bit on the skinny side, okay, if their body condition score out of 9, if they're a 3 or a 4, they're going to produce much less quality and quantity of colostrum that's able to get passed into those calves. Okay, so if we're a little bit on the thin side right now, this is something to be prepared for, that and bear in mind that we may not be transmitting that immune transfer like we traditionally would. Okay, so obviously, if we have issues during delivery, issues during calving itself can impact the immune transfer, and also the environment itself. We have really dirty teats that are slop full of manure, and that's what the calf latches on. Obviously, that can interfere with some of the immune transfer as well. So to show you some of the data, again, body condition score 3, 4, 5. 3, 4, 5, 6. Our ideal kind of calving body condition score would kind of be right here in this 5, 5.5 for most of our cattle. Obviously a 1 is super skinny that she's so weak she can't stand up. 9 is so fat that she can't fit into a trailer. She's so gobby fat. So those are the two extremes, and we want our best production method is kind of right in the center. And as you can see, and as we start to drop our body condition score, the serum absorbed antibody, IgG, really starts to decrease once we start having a little bit more skinny cows. Okay, so this does affect the health and the immune function of our young calves, even by how much fat cover our cows have. Okay, so it's one more reason to try to maintain that body condition through the fall, all the way into the winter prior to calving. Okay, so that's colostrum. Colostrum's critical. Colostrum's number 1. But cold, I really want to focus a little bit on cold stress right now. My best recommendation for everyone that's listening right now is to make sure you have a rectal thermometer with you handy if you're calving right now. Okay, the best indicator on whether these calves need a little extra help to get up and going, to defrost a little bit, if they need our help, is a rectal thermometer. Taking rectal temperatures is the best way to monitor hypothermia. Okay, that's cold stress. Hypo is low, thermia is temperature, so low temperature in these calves. A calf, when it hits the ground, should have a body temperature of 101.5 to about 102. That's the normal resting body temperature of cattle. Okay, even the calves should be about 101 whenever they're born. Now, unfortunately, especially with temperatures like we have, and they are freshly born in the outside, we can have what's called immersion hypothermia. Don't remember that. You don't need to worry about that. All that you really need to know is when they hit the ground, they're wet. And what happens if you walk outside right now when it's 5 degrees outside and you have wet hair, you get chilled rather quickly. Okay, it's that nidus to pull heat out of your body. And this is what happens to our newborn calves. They're wet and they lose heat rapidly. Okay, so at what temperature do we start seeing different changes? Animals that get below 100 degrees Fahrenheit, okay, they don't have to drop very far. They could use some help. Okay, they could absolutely use some help to get warmed back up. So 100 degrees is where we start seeing mild signs of hypothermia. Once we start getting into the middle 90s, we start seeing severe hypothermia. If we get below about 94 degrees, this is where we start having blood flow stops going to the outside of the body. This is where we run into frostbite with ears and tails and feet. The body itself it's a protective mechanism. It keeps the heart pumping and the brain warm. Okay, so it will sacrifice the limbs to keep the brain and the heart going. Now, when it does that, obviously it's shunning the blood around, but eventually we will start seeing organs get cold. And when organs get cold, they shut down. So below 94, we can go all the way as low as about 80 in mid 80s, and the animal can still be viable. But in about 85, 86 degrees Fahrenheit, the calf will be, you will think it's died. Okay. It's flat out, it's non-responsive other than a couple of agonal breaths, maybe 4 a minute. And it's very easy to miss. Some of those can be brought back. Okay, but it does take some time and it does take some effort. So to figure out where you are on the spectrum, how severe some of this hypothermia is, carry a rectal thermometer, and don't be afraid to use that to figure out if some of these calves need to get a little extra help. First and foremost, if we have a cold calf and it's just hit the ground, we have to get it dry. Okay, wetness and dampness on these young calves, especially early in life, those will kill the calves quicker than anything. We need to get them dry. We need to get them warmed up as quick as possible. Kind of the old tried and true is the floorboard heater in your pickup. Okay, the lower foot defrost. You can actually set up a little cardboard box in the passenger seat over the seat, and you can put the calf underneath it. You can put some blankets over the top to actually act as a little kind of incubator right on the floorboard of your passenger side of your pickup. I will warn you, if you have carpet if you have carpet on the floor, that's probably not the best thing. But if this is your work pickup and you have some nice WeatherTech floor mats or something along those lines, it works really well. So floorboard of the pickup, how long does something like that take? Okay, it can take an hour and a half plus to warm a calf up through that blowing air. Okay, we want to make sure it does take time to get them at. Once you've gotten them over that 100 degrees Fahrenheit, okay, and they're dry, that's when we can introduce them back to mom. Okay, heating lamps. Okay, heating lamps and warm blankets. We give them kind of the thermal protection from the ground. If we have them in a barn, we have them out in the shop. We have them well bedded. We have these heat lamps. Okay, be careful with heat lamps. Once the animals start warming up, that's when they start jumping around and they can knock over and break the bulb. They can start a fire. Okay, I do have a picture here. They have some new, kind of fire resistant, fireproof, kind of knock around heating lamps that are a little bit safer than what we used to use in the past. So again, very, very useful, but we do need to be careful with those. Warm water immersion. Okay, the old bathtub. Okay, that's what a lot of people kind of go to, especially in some of these extreme situations with temperature. So I really do want to talk about kind of the ins and outs, the do's and don'ts, so to speak, of water immersion. Okay, if you're gonna, other than dealing with other household members that may not be thrilled with you bringing a calf into the bathtub, here's some things to keep in mind. We can't put those cold calves directly into warm water. We have to warm that water up over a period of time. We start with kind of lukewarm, room temperature water, which may be 70, 80 degrees. We have to slowly keep adding warmer water to get it up to a maximum of about that 100 degrees Fahrenheit. We don't want to put them in much warmer than that. If we put them directly into really warm water, really hot water, what can happen is it's hot water shock. All the cold blood that's in the extremities rushes back to the heart, and the heart can stall and they die of a heart failure. Okay, so that shock mechanism is what we're trying to avoid. So we start with kind of lukewarm water and we build that up. Use your thermometer for this and make sure we don't get it too hot. We don't want to cook these calves. We do have to slowly warm them up over a period of time. So warm water immersion, they've done the studies, they've done the work to figure out, which is the fastest, whether we're using blankets or, a hot box or whatever we might be using. Warm water immersion is about the quickest. However, quickest can still take about an hour and 20 minutes, an hour and a half. Okay, so it is labor intensive. We have to keep adding water. We still have to do that slowly, but we can get them back up to body temperature in about an hour and a half. Okay, meanwhile, we have to be there with them to make sure they don't drown, to make sure they don't fall into the water. So it is very labor intensive to do it correctly. Warming boxes, there's a lot of, I've known some producers that have made some that are pretty inventive. We want to make sure they're vented. We don't want to circulate just hot, humid air as they're starting to dry. There's a lot of products that are out on the market that are commercially available. They work very well. They have protective, it kind of circulates that air, kind of works as a convection oven, but then blows out the humidity. So again, a lot of options that are available all work very well. Keep in your back pocket that if you have a severely cold, we're get into those 80s, you may want to call your veterinarian. Okay, they can do some different things with warm water IVs. So that they'll take a sterile saline and they'll hook it up to the tubes with warmer water to help to kind of moderate that body temperature and bring it back warmer a little bit quicker. Okay, but take your time. Okay, make sure that we get that done correctly. Plan if we're going to warm up a cold calf that it's going to take that calf, an hour and a half plus to be able to get warm back up. Okay, so again, if you're going to use warm water immersion, if you're going to use the bathtub, don't drop that calf into really hot water. Okay, that we can send those calves into shock, and we can unfortunately kill them inadvertently. Okay, so it does take time. We only want to warm them up to about 100 degrees. Once we get them there, that's where we can get them dried off and taken hopefully back out to mom. If it's a directly newborn calf, that was born into a snowbank and is already frozen halfway coming out, we try to warm those up before we administer colostrum. Okay, so those are some good basic recommendations on warming some calves up, where those critical thresholds are on the rectal temperature. And if you don't have a rectal temperature, please go get one. Okay, that's one of the best indicators that we have on if these animals need help and how much help they'll end up needing. Okay, going to cover a little bit about scours, and and we'll kind of finish up for the evening. Anybody that's managed cow-calf operations has run into scour issues. It's costly. Poor performance, death loss, medical expense, and labor. It's really taxing on all of us to deal with scouring calves. Okay, scours caused by a number of different pathogens. We have bacteria, we have viruses, we have protozoa. Kind of sounds like abortions, right? So we have some of these issues. Outside of salmonella, all of these pathogens circulate naturally within our herd. All of our cows that we have some carriers, these are naturally found in the environment within all of our cow herds, like outside of salmonella. Okay, so these are they're just commonly found. Okay, so it's expected to see some of these problems. So again, some of the diagnostic lab results that we had from 2019, some of our common ones: crypto, rotavirus, coronavirus, different coronavirus than what we're dealing with COVID-19, right? This is the bovine coronavirus, very, very different virus, still just falls within that same family. So rota, corona, and crypto. Crypto is a parasite, is a protozoal parasite. Okay, so those are the most common that we've been seeing, and year in and year out, we can have co-infections, as we can see with a lot of these, but these are kind of the main players. It's a good idea to keep in mind the age, okay, age at when we see these scours. E. coli happens very early in life. They get exposed it from the teat ends before they've had colostrum. Okay, so those we'll see within the first couple of days. But rota, corona, and crypto happen in that critical period of about a week to about 3 weeks of age. That's when we see rotavirus, coronavirus, and crypto causing scours. Okay, those are our main causes that we manage and deal with year in and year out. Okay, what's interesting about these is they're viruses. Okay, they don't respond to antibiotics or things like that, but they kind of run its course, cause severe diarrhea until that calf is able to. If we can maintain hydration, we can usually get through some of these, and they're self-limiting. So how do we help control this? Well, some of these are easier said than done, but I do like to go through them because it's the idea, and we can modify small things within any given operation to help decrease the risk. If at all possible, if we can have them calving in a cleaner area where we don't have the exposure early in life, the better. And now, clean environment can take a lot of different that means a lot of different things. I'm not talking about a sterile hospital room. I'm talking about an area that has not been trampled on and frequented often by the entire herd, where we have a buildup of pathogens from manure and urine. Okay, so some things that we can do to spread out the contamination during the calving season. I think number one, we can feed in different locations. We can change our feeding sites. The 3 locations that cattle spend most of their time in a pasture is where they eat, where they rest, and where they drink. Okay, usually our water is stationary, but we can usually move where we feed them and where we have them rest. Especially if we have shelters, we can use portable shelters and take them in different areas. We can bed cattle down in different locations and move that. We're not building up a massive amount of contamination in one area. Okay, so the solution to pollution is dilution. If we can dilute that same amount of pollution much greater, okay, we don't have as much exposure to these newborn calves. That's how we minimize that contamination. Older calves. The other key idea with scours is we always see scours the latter third or so of our herd that hasn't calved. What happens is the older calves, they act as amplifiers. They are amplifiers of these viruses and crypto, if rota, corona, and crypto, the calves that are born early in the season get exposed to these at a very small, low level that circulate through the herd. Unfortunately, these young calves, they replicate rapidly. They don't cause disease, but they become this huge potential and amplifier of these pathogens. They just spread them all over the place. Okay, that's why we start seeing this as the calving season progresses. That's when we actually run into that's where we run into scour issues. Okay, because we've severely contaminated that environment. Okay, so one key thing that we can use management wise is, can we separate calf by age? Can we separate calf by if we calve for a month even, and then separate those or move them into a different location and have that critical high risk group, that those ladder calvers, can we have them calving in a different environment, a different location, and preferably a clean environment where we can reduce the risk of those animals. Okay, so those are some basic things. I mean, the by the book program to manage around scours, it's called the Sandhills calving system. I'm sure a lot of you have already heard about it. This is kind of the true mechanism that it is pretty intensive to directly manage and reduce scours. And the idea is that calve in a clean environment as much as we can and separate calf by age. This is where we'll have several different paddocks that they'll be calving in. They start with all the cattle in the first one. They'll calve for 2 to 3 weeks. Anything that has dropped a calf stays in that pasture. All the pregnant ones, we move into the next paddock. Okay, and we'll calve for another 2 or 3 weeks. And then we do that, so on and so forth. So we're not sorting pairs. We're just sorting off the still pregnant ones. Once the youngest animal's about a month of age, we mix them all back together. Okay, that's how it's done. That's how it's written. We know it works. It's pretty labor intensive, takes a lot of planning, a lot of fence work. Okay, and I'm not expecting everybody to go start building fence today. What I am expecting you to do is take away some of the key components of the Sandhills calving system. Separate calf by age, break that amplification cycle of those pathogens, and 2, try to modify the environment the best that we can to reduce and try to have them calve in a clean environment. So whether we're moving, feeding, moving where we bed them, where they rest, those are some key things that can help. Or what if you're calving close to facilities? Okay, you have a particular calving pasture. Are there some things you can do? Well, can you move pairs out? Okay, can we still separate calf by age every couple weeks? Are there some things that we can do to help reduce that risk and reduce the contamination? Every little bit helps. Okay, it doesn't have to be perfect, but every management decision that you make to help decrease that risk potential really makes it is a big deal. Okay, so do the best you can. When you do have calf scours, some basic rules of thumb. If they're still, the tongue is still warm, they're still nursing, oral electrolytes. Okay, we're trying to protect against dehydration. Dehydration is what kills these calves. Okay, so if they're still up, they're still going, okay, that's when we jump on the oral electrolytes, work with your local veterinarian for the products that they recommend. There's a lot of options that are out there. Again, that's where kind of working with your local expert is, and what you can find locally is really what you should go with. And now, if they're down and out, they have a cold mouth and the weather's cold, they probably need to go into your local vet. Okay, that's where we put them in the hot box. We end up hooking them up with IV fluids. We put a pile of fluids into their IV to help revive them. By that point, they're probably pushing 10% dehydration, and they can die from that amount of dehydration. So that's kind of the critical point. If they still have that warm mouth, if they still have that suckle reflex, we can get some oral electrolytes down. After that, we really need to. If they're worse than that, if they're kind of flat out, that's where they really need some extra help to try to save them. So diagnostic samples for scouring calves. Okay, I kind of run along the same kind of program as with abortions. If we have 2 to 3 happening in a pretty close window, we have a cluster. I'm probably going to send off some samples and work with the local vet to try to figure out an answer. Okay. One of the number one reasons for that is understanding which pathogens are involved and if people can get it. Crypto, salmonella, things like that. People are susceptible to and get pretty ill, especially if you have some immunocompromised family members. They can get exposed just from your clothing. Okay, so that's where it's more the human safety factor on jumping on and dealing with some of these scour issues than anything. Okay, we really need to protect ourselves as well, and that's where getting diagnostics so we know exactly what we're dealing with can go a long way. So review vaccines, they're a tool in the toolbox. I've talked mostly about management, not about vaccines. Okay. We need to have realistic expectations with vaccines. They are not the solve every issue. Okay. It's the basic husbandry practices we do day in and day out that make the biggest that make the biggest difference. Okay. General guidelines. When would we use vaccines? Pre-breeding, potentially preg check for our cows, trying to protect pregnancy, trying to protect that unborn calf. Okay. Calves, obviously once they get a little bit older, once they're the immune function from the colostrum starts to wane is when we start to see and manage those. All right, I'm about done. I want 2 minutes to cover a little bit about this situation. Itchy cattle. I'm sure several of you are dealing with itchy cattle right now. Okay, so winter lice control, real quick. We have systemic treatments and we have topical treatments. Okay, our porons. Or if we're dealing with lice right now, generally we're going to go after some of these lice-specific therapies. Okay, they're the topical porons that we use. They're the same chemicals that we use for fly control. Okay, that's really what we use. The key thing to walk away with is if you're dealing with lice and you're going to treat them, you need to treat every animal. Okay, you need to treat all of them. Because all of them will be infected. And one animal, if you forget to treat them, can reinfect the entire group. Okay, this is something also of a concern if you bring in new animals. They can inadvertently bring in lice. Most products are labeled for retreatment. Reason for that is the egg, the nit, forms this glue and attaches to the hair follicle. It's really resilient against treatment. Okay, so what happens is we treat and kill all the adults, but then that nit can hatch, and about 21 days later, we have a reinfestation. Okay, just because we didn't kill the eggs. That's why a lot of the products are labeled for a retreatment in 14 days. There are some longer lasting products, and there is a product available out there that has an IGR that do have a label for a one-time treatment. So if you're going for treatment, make sure you read the label and know and understand if they need retreatment or if it's a one-time and wipes out that infestation. Okay. So that's about all I have for you tonight. I open it up. If you guys have questions, be happy to answer them. But just wanted to throw a few tips and tidbits with recognizing and when to call for help if you're dealing with some abortion and pregnancy losses. Colostrum, the importance thereof, and that really helps control disease early in life, mainly scours. Okay, getting that colostrum in, and then ultimately manage some of the scour issues that we're dealing with. And then just wanted to throw out that quick tidbit about lice because I've seen a lot of lousy cattle lately, so I wanted to throw that in there. But thank you very much for logging in tonight. I hope it was worth your time to take away a few tips that hopefully help you out here through the next couple of weeks.
Do we have any questions for Dr. Tarpoff? Anybody want to shout them out? I do have one in the chat box that came to me privately. Can you talk about the difference between killed and modified live vaccines and which one to choose in which situation?
Yeah, so modified live versus killed. Actually, I just talked to my students about this today in class. I was talking about vaccines, so it's fresh in my mind. So a modified live is it's a live virus that has to replicate inside the body. Now, it's a virus that's dumbed down where it doesn't cause the same disease as what the wild type viruses do. Now, those viruses are dumbed down in a way they still have to replicate inside the host. We want them to replicate inside the host, our cows, because it better mimics the natural infection. Okay, so it better mimics the natural infection, so we have a more robust, more complete immune response, and we produce memory against that. Okay, so that's a modified live. Now, a killed product, okay, a killed product is it is completely sterile. They have lysed and killed whatever virus or whatever product we're trying to vaccinate against. Okay, so in that aspect, it does not replicate on the inside of the body. So it's just a mass of antigen that gets injected into the body. Now, by itself, our immune system doesn't respond to that. So why killed viruses, killed vaccines actually work is what's called an adjuvant. Adjuvants, each pharmaceutical company has adjuvants that they've created that either slow release those particles of the killed pathogen that we have in the vaccine. So either slowly releases it for the immune system to see, directly stimulates the immune system, or kind of presents those antigens a particular way for our immune system to recognize them. Okay, so in general, killed vaccines are a little bit safer. They are more prone to causing anaphylaxis. Okay, if you've ever had an anaphylactic reaction, whenever you're vaccinating groups of animals, that has to do with the adjuvant. Sometimes we have an overstimulation soon after injection with those. Kilds are a little bit more shelf stable. Unfortunately, our kilds do not provide quite a robust protection. Okay, so that's the downside. Is we generally have to vaccinate more often. We need booster doses, and we don't have as robust or as long-lasting protection from them. The modified lives, we do have a much higher level of protection. However, if you read the label of modified lives, some of them, excuse me, if you read the label, some of them are proven protection for and can be used for pregnant animals, only if that animal has previously seen that vaccine within the last year. Okay, the reason for that is mostly the IBR strain. It has been documented that pregnant animals could potentially abort from the use of that modified live, especially in a naive cow. So if you have an unknown history on the cow, or it has never seen a modified live before, or it's just been on a killed, and we come in and vaccinate it with a modified live while it was pregnant, there is a potential to have a pregnancy loss. Okay, so that's one of the main risks. So where do we use these? How do we interact with these? If we're pre-breeding, okay, if we're 30 days prior to breeding, and I consider if you're doing a sync program, as soon as you start your sync program, I consider that breeding season. So I'm 30 days prior to that. But if we start pre-breeding, okay, by about 30 days, that's kind of the most ideal time to use modified live. We get the maximum protection against some of the issues that can happen with early embryonic losses that are infection, but we also have long-lasting immunity out towards the end of pregnancy. Now, we also have modified live with killed products in there. Our Vibrio and Lepto components of those are actually killed. So we can have components of different vaccines that some are alive, some are dead. I will say that there's been some recent work that modified lives do really well at protecting cattle from creating a persistently infected BVD calf. Okay, so PIs, what we're really concerned about, modified lives do a pretty good job at preventing those completely when we vaccinate pre-breeding. Now, not the same cannot be said for killed. Some recent work, they tested a number of different killed products that all have BVD, killed BVD strains, and an enormous amount of BVD PIs. If we challenge the cows, they can still create PI calves. So I think that's the main difference, is understanding that we don't just give modified lives to every cow willy-nilly without understanding their background. We do have to be careful with the use, but they are highly effective, whenever you use them appropriately.
Awesome. We did receive another question, and I think we're probably all on the same page coming into this weekend with even colder weather. You were asked, can you comment on how much more energy cows need in this sub-zero weather?
Yeah, so how much energy? Boy, I have that slide somewhere I need to pull up. So right now, our critical temperature is these cattle should have a heavy winter coat. We should be about 17 degrees. We'll be about what is it? Is it a percent increase? So they'll need about 15-20% more energy than what they typically would just to maintain. Now cattle are robust. They can withstand quite a bit for short periods of time. Okay. Now the cold nights, okay, as long as they have a windbreak, the cold temperature by themselves for our cows, as long as we have them bedded down and they're out of the wind, they can be pretty good. They'll still be burning a lot of energy. But if we decrease some of the wind that really cuts through them, and they have a comfortable area that's protected from the frozen ground where they can lay down, where they can kind of herd up, those are all things that reduce the energy expenditure losses due to staying warm. So no, I think I don't have the exact information. Oh yes, and actually my colleague Sandy just messaged me. I thought it was 1% more energy that is needed below 17 degrees Fahrenheit. So every degree below that is 1% more energy needed. Yeah.
Awesome.
So if we're going to be around 0 degrees, we need about 15% more.
Right. I think that's going to be very helpful as currently, and as we get even colder over the weekend. So one last chance for anybody to ask questions. All right. I don't see anything coming in. Oh, I think we have one. Somebody asked, is there a way to go back and watch this whole seminar again via a playback? Yes, so all the sessions will be recorded or are recorded. We're going to release all of those at the end of the series. So get with whoever your extension agent is of us three, and then they should have it on their website or their Facebook page. So reach out to your extension agent in your county or your district, and then we'll make sure that you get that. I would assume we'll also send out an email to everyone registered at the end, letting you know where you can find that information as well. So I don't think I have any more questions for you, AJ. We really appreciate you being here tonight. I think you gave us a lot of really helpful information and timely information. So at this time, I'm going to put a link in the chat box. That link is going to take you to an evaluation for tonight's session. Evaluations are really important to us. It lets us know what we're doing well, what we could work on. And then it also includes an open-ended question at the end where you can tell us what you would like to see in terms of livestock programming in your county. So I really highly encourage you all to go to that link and fill out that survey. It only should take a minute or two, and it really helps us out. So it's in the chat box, so you can go over there once we're done here. I just wanted to introduce our next week's speaker. So hopefully you'll come back next Thursday at the same time. It's the same Zoom link. We're going to have Dr. Sandy Johnson. She'll be giving us an update on estrus synchronization strategies and options for sex semen. So we hope you keep warm this weekend, and we hope we see you back next Thursday. So thank you for joining us tonight.